Welcome back to What's Now. Lung cancer is a devastating diagnosis, but there's some new research giving some hope on the horizon. Let's find out more right now.
For people diagnosed with lung cancer, there's a lot of uncertainty around what's next. But a new development in research was unveiled at a major medical meeting, giving hope to some patients with a certain type of advanced non-small cell lung cancer. Here with important information on managing a lung cancer diagnosis and new research findings is Steve McCune from Northwest Georgia Oncology Center, MD, PhD. Dr. McCune, thanks for joining us today.
Thank you. My pleasure, Christine.
What is the most common type of lung cancer, and what is its impact, especially on Americans?
So the most common type of lung cancer is called non-small cell lung cancer, and that's about 85% of all lung cancers. And unfortunately, lung cancer is the leading cause of cancer-related deaths in the United States.
If someone is newly diagnosed with non-small cell lung cancer, what are some of their options?
So often when people get diagnosed with non-small cell lung cancer, they're in a situation where the disease has already progressed from the lungs to another part of the body, and that's called metastatic disease. So it's really worth talking to their physician or to a medical oncologist to have an idea about the treatment options that are available.
Tell us about the new research findings that were recently unveiled at a major medical meeting.
So the new findings and the result that's really hopeful and groundbreaking for patients is the use of two drugs called Opdivo and Yervoy, which are immunotherapy drugs. And these lead to long-term survival for people with newly diagnosed non-small cell lung cancer.
And how does this treatment combination work?
So the two drugs work together to both stimulate and then activate the immune system. They're made by a company called Bristol Myers Squibb, and I was one of the investigators in the clinical trial that led to the FDA approval for this combination. So the two drugs really work to cause a person's own immune system to attack the lung cancer. So this has no chemotherapy involved. There are side effects, but those are usually fairly manageable, and that's something that a person's oncologist can really help coordinate. This really is a game-changing treatment in that it leads to long-term survival compared to traditional chemotherapy.
And where can we go for more information about this?
So two good websites, the American Cancer Society at cancer.org, or Opdivo, which is opdivo.com, for the actual trial information.
Well, thank you so much, Dr. Steve McCune, for joining us today with this important information about new research and options for those who have non-small cell lung cancer. We appreciate your time.
Thank you, Christine.